Next is administrative simplification. This is very, very important. Title 2 talks about administrative simplification. Here there are so many rules that we are going to see. Most importantly, we are going to see the privacy rule. What is a privacy rule? We all know health information is very, very confidential, very, very secret. In order to keep it very, very safe and to be private, we have something called like PHI, called as a protected health information. So the information of these patients should be kept confidential and they should be protected. Nowadays, the PHI has become an ePHI, which is an electronic version due to the advent of high-tech Health Information Technology Act. Because of this increased IT, healthcare sector is now come under this influence of this IT. We have now got like ePHI, electronic PHI, because now we have this electronic health records and electronic medical records. What constitute a PHI? Any information that gives you some detail. For example, patient's name, that is going to give you the identity of the patient. Something that makes a patient known becomes a health information, and that needs to be protected. The patient's medical record number, patient's phone numbers, fax numbers, vehicle numbers, social security number, date of birth, date of service, and URL, device identifiers, all these come within the protected health information, and the healthcare providers are supposed to protect them.